Honourable Speaker, sir, during and after COVID-19, we seem to have shifted our focus away from this deadly disease, HIV. However, it is alarming that Fiji has increased its estimated HIV infection by 129% over the last decade. And according to the UNAIDS global report, we are now one of the top 5 countries out of a pool of 38 countries with an alarming rise in infection rates. According to the UNAIDS reports, Fiji is rated second in the Asia-Pacific region with the fastest growing HIV infection and recording 46 HIV-related deaths last year, which is also the highest in the region and for Fiji. In 2022, Fiji recorded 245 HIV compared to 151 cases in 2021, which is almost an increase of 100%. Honourable Speaker, sir, it is alarming to note that 14 of these cases affect children who are under the tender age of 4 years old. The Ministry will not rest on its laurels in fight against HIV, and we are grateful that the HIV and AIDS Prevention Control Program has been allocated $200,000 in the 2023-2024 budget, which is an increase of $110,000, approximately 122%. I'd like to respond to the Leader of Opposition remarks on the funds from the Ministry being utilized in the Ministry's Education $200 Back to School initiative. The Ministry redeployed $10.4 million back to the Ministry of Finance in the latter half of this last budget year. In essence, the deployment of funds were from allocations that we knew could not be spent within the allocated financial year because of the following reasons. By the latter half of the last financial year, the scoping of a number of capital projects, including Savu Hospital refurbishment project, had not yet been completed. We knew by the time that scoping would be completed, we would have to rely on the budget that is currently under debate and discussions today to fund the refurbishment. This was because of a highly centralized tender process, which in the previous government, which was all done in the construction implementation unit. To compensate this inherited shortcoming, we embarked on a strong community engagement program, which has already borne fruit, as we see in the Savu Hospital and many of the small healthcare facilities around the country. Furthermore, moving forward, I've initiated a controlled, decentralized process to ensure the more completion of tender processes so that we can facilitate more timely capital expenditure. So in summary, the redeployment was a logical response where unavoidable expenditure difficulties within the Ministry of Health from factors we inherited and urgent needs within the Ministry of Education was mitigated. Honourable Speaker, sir, the Honourable Leader of Opposition further adds that they have done so much in regards to infrastructure in the Ministry of Health and Medical Services. He stated that whilst the government the previous government built Nakasi Health Centre, Wildlife Health Centre, Navos Hospital, KRC, Rotuma, the renovation is CWM, etc. Congratulations for your efforts. But today, there is no connection of sewage to the main line in Nakasi Health Centre. Now, Hosa Hospital in Kiasi had officially opened its doors with borrowed items from various hospitals and health centres, thus affecting the provision of quality health care in these facilities. Rotuma Hospital cost the Ministry approximately $8 million to build. The groundbreaking ceremony was held in 2014, yet 9 years down the line. It is yet to be completed, and this time we will do it right when the time is ready for opening. Sir, the State of Nations Infrastructure Media Tour in February revealed the appalling state of our 100-year-old colonial war memorial hospital. So the picture is worth 1,000 words.